Hello everyone. This is my first podcast. I'm doing it with the famous Dr. Aubrey Grey, but I kind of looked up on Gemini how famous Dr. Aubrey Grey is, and according to Gemini, only approximately 1% of America knows who he is. But Taylor Swift, like 85% of Americans know who Taylor Swift is. So I was kind of wondering, yeah. So basically, Dr. Aubrey de Grey has. I kind of knew Dr. Aubrey knew of Dr. Aubrey de Grey's work 20 years ago. So he basically thinks one of the things he thinks is well, basically, if you don't know who Dr. Aubrey de Grey is, please do your research. Uh, research, do some research on him. But So he thinks the first 1,000-year old is already alive, and he said this approximately 20 years ago. So I'm just gonna Lord de Grey um, uh, introduce, give a short introduction of himself now, please.
All right. Thank you, Sash. Yeah, 1% is not very good, is it? I try to work on that. But yeah, so I work on the biology of aging, as you've indicated, and I am not in favor of aging. I would like to fix it. I would like to make sure that people do not have to get sick when they get old. And I've been doing that for about 30 years now, and it's been going all right, I guess. We are a lot closer to that goal than we were when I began, but there's still quite a long way to go. So I am still, working hard to try to make that happen. The main thing that I am focusing on is a divide and conquer damage repair approach, essentially preventative maintenance for the body. And that really means identifying all of the various types of damage that the body does to itself in the course of its normal operation, the same way that any machine damages itself as a side effect of operating. Identifying those things and identifying ways to repair them so that they never reach the level that causes us to be sick. The body is, of course, set up to tolerate a certain amount of this self-inflicted damage, and so that's why we don't get sick until late in life. But eventually that threshold is exceeded, and I want to stop that from happening. So that's basically me. I am the chief science officer and president of a nonprofit based in California. We do some of the early stage research in mice that leads to the understanding of what to do in humans down the road. And, things are going okay.
Awesome. Okay. I'm just going to ask some non-science questions real quick. So you came to you're British. I guess, in my opinion, you're British American. So
that's fair. I was born in Britain. I only became a U.S. citizen a few years ago, but
okay.
Yes, I definitely live here now.
Okay, so you are you are an American citizen. That's awesome. Okay. Uh, what else? Oh yeah. So the let me see. I have some bunch of questions here. Let me see what to ask. Okay, so let me ask this. I kind of did some research. Well, not like you. You probably do it much better. Uh, uh, oh yeah, let me ask something that I wanted to ask. So, like, you have achieved a lot. So you're very people. Uh, People respect you, and you've achieved a lot. So I'm like 46 now. At my age, you've achieved way more uh, at 45. So I think you were around 45 when you did that famous TED talk. So let me ask you something. So, like, did you know from a young age? But did you like outperform your peers? Did you know that you were gonna be like do something great?
It doesn't really work like that. I mean, yeah, I did okay academically when I was in school and when I was in college, but really the point is not whether one knows one is going to make a difference, but whether one knows whether one wants to try to make a difference. Because the thing about anything that's, that makes a big difference to humanity is it's inherently very difficult, and you get there not just by being talented, but by having a lot of luck. So the mindset, the attitude that you have to have in order to dedicate your life to that kind of thing is not a kind of selfish one, based on trying to get prizes and money and admiration and so on. What it's actually about is just being part of the team, part of the army that tries to achieve the thing. And if somebody else succeeds, that's just as good as if you succeed. That's the critical attitude to have. So yeah, I mean, I've always been that way. I've certainly always known ever since I was a young kid that I wanted to make a difference to the world. And initially, I actually didn't become a biologist. Initially, I was a computer scientist, and I worked on artificial intelligence research. That's when artificial intelligence was a completely different thing than now. But yeah, I switched to biology in the mid-90s, about 30 years ago. And yeah, to work on the problem of aging, which I definitely consider to be the world's most important problem. And I did so. I switched fields because I discovered, to my horror, that hardly anybody else was working on it. Not because nobody else is smart or nobody else knows any biology, but because people had kind of got themselves into a fatalist attitude, saying like, well, there's nothing that can be done about it. It's kind of woven into the fabric of the universe in some way that is off limits to medicine, even in theory. And I said to myself, I don't think that's true. So I thought I'll have a go. Yeah, but the progress that's been made, yeah, I mean, I'm definitely proud of what I've contributed, both scientifically and in terms of building this community. As you said at the beginning, I more or less, built this community from scratch. So I'm proud of that. But what matters is the fact that we're still not there, and there's a lot of people alongside me now trying to get there.
Right. Let me just say, if you came to this, if you found this video, um, I'm part of the Aubrey Grey team. Most likely, I would like to say that. I would like to think that. So, most likely, if you come to this video, you probably search Aubrey Grey on YouTube. And if you came to this video, I would, and if you're part of the Aubrey Grey team, if you are part of the Aubrey Grey fan club, I would like for you to subscribe to me. But I'm trying to be successful on YouTube, but not for the money. I'm gonna all the money that I make, that I hope to make from YouTube. I plan on contributing to research. Yeah. So what the next question is? I watch. I kind of watch when I have time. I watch a lot of Aubrey Grey videos on YouTube, so I know a lot about uh, what you think, and I think so. What you want done. So I came across I learned from a video that you would like $1 billion in 10 years, basically $100 million a month. I
Yeah.
mean, a year. So yeah, tell us about that.
Right. So yeah, I mean, if you think about it, that sounds like a lot of money to most people, but if you compare it with other things that money gets spent on, it's a tiny amount. I mean, the average clinical trial, phase 3 clinical trial to test for the efficacy of one drug costs around $1 billion. and it takes about a decade. So that's about the kind of money that I think we need in order to really bring aging under comprehensive medical control is equivalent to the amount of money spent on one clinical trial for one drug. Now, of course, the question immediately arises, how can I possibly say that? How could something so complicated as aging, so much more complicated than a single disease that might be treated by a single drug, how can that be? And the answer is that this is not, by any means, all the money that would be needed to bring aging under control. What it is the money that would be needed to make enough progress so as to eliminate this fatalism I mentioned a moment ago. So as to get, in other words, to get humanity to understand that aging is not woven into the fabric of the universe, and we can actually bring it under control if we try. And the way that $1 billion would be spent, and indeed I think it's quite possible that it might take a good deal less than $1 billion at this point, maybe only $20 million. The way it would be spent is by making dramatic progress in laboratory organisms, in particular in mice. Mice are, they're not humans, but they have fur and legs and stuff. They're not. If you make a mouse live twice as long as it normally would, that's a lot more impactful than if you make a fruit fly live twice as long as it normally would. So that's what we try to do. And yeah, I mean, the reason I think we can probably do it pretty soon, like in the next 3 or 4 years, if we have a little bit of money, is because of all the progress that has already been made, not only by the research teams that I have led, but by the research teams around the world that have been working on this in parallel. The amount of progress that's been made, even in the past 5 years, in the past 10 or 15 years, is astronomical if I look back to where things were back then. It still hasn't translated into the, if you like, the bottom line, which is actually extending mouse lifespan more than we could do, 15 years ago or 50 years ago even. But I believe that we are one short step away from doing that. And that's why it's so tragic that the studies that I feel need to be done are not being done, either by me or by anybody else. And as a result, the defeat of aging is being delayed, and lots of future lives are going to be lost.
That's not good. So you basically said in a video a billionaire would make a big difference, but so let me just talk a little bit, and I would like you to comment about that. So Bill Gates, he's not interested in extending the human lifespan. Um, Neither is Elon Musk. But Jeff Bezos is interested in uh, extending the lifespan. So is Mark Zuckerberg. He is.
Yeah, right. So you're quite right. There is a spectrum of opinion among the tech bros, as people like to call them, the wealthy people who've dominated the wealthy people in the world. But yeah, quite a few of them are into this. Larry Page and Sergey Brin from Google are another example. They started a company called Calico. And so, I don't need everybody to do this. I don't object to the fact that Bill Gates prefers to spend his money getting, more mosquito nets into Africa. That's fine. That's important too. But there are plenty of people who understand that aging is a bad thing and that we could fix it if we tried. And they are trying. Then the problem is how they spend the money that they choose to allocate to this thing. And unfortunately, one sad characteristic of people who make a lot of money is that they tend to feel that they know everything, even when they don't. So a huge amount of money has been thrown down the toilet at Calico over the past decade. Altos is potentially going to do better, but the jury is out. That's Bezos' company, of course. But there are other companies that are doing better. There's a company named Retro Biosciences, which was seed funded by Sam Altman, and that's doing a bit better. So yeah, I mean, we shall see. but I'm still
Oh yeah.
grinding. I'm still grinding away trying to get,
Uh,
you know, one or other of these people to actually trust me. And that's what's happened in the past, of course, over the past 20 years. The small amounts of money that I have been able to bring in have been because people see that I know my stuff.
yeah. Uh, so I have to get good at. This is my first podcast, so I have to get very good at it. But uh, so I have another. I basically looked up I I do I do some research on my own, but I was kind of interested in whole body transplantation.
Hmm.
Uh, so I was wondering if clone if sort of like if like cloning a body and then doing a head transplant would be effective. But I read in somewhere on the internet that you think uh, the whole body would be better or something like that. Am I
All
right?
right, let me go into a few details here. So, and this is actually quite topical right now because literally yesterday or the day before, a very high profile piece came out in MIT Technology Review, which is a very well respected, general audience publication, talking about the work that's going on in whole body replacement and related areas. So, yeah, let me go through this. So, at the moment, of course, we have a very established phenomenon of organ transplantation. Some guy, drives his motorbike into a brick wall and dies. His organs may be donated to other people. And of course, the recipient of these organs is somebody whose organ is failing for whatever reason, and there's nothing that could be done other than putting in a new one. But there is this enormous difficulty that we don't have enough people driving their motorbikes into brick walls, right? We have a huge shortage of supply of these organs, and that is even worse because of the need for the donor and the recipient to have compatible immune systems, so that the amount of suppression of the immune system in the recipient is tolerable. Um, so yeah, this is all very unsatisfactory. And of course, people have known this for a very long time. And for decades, people have been trying really hard to grow new organs in the laboratory rather than getting them from someone who just died. Um, and it turns out that this is really hard. I mean, it's actually not so hard for simple organs that don't have much of a bloodstream. So, like the bladder, for example, that's now routine. It's done quite a lot. But for something like a kidney or a liver, it just you can't grow these things. People have tried some very ingenious ways to get around that problem, and one of them, which you just alluded to, is organ printing. The idea of using essentially an inkjet printer, where the thing that is laid down is not ink, but instead cells and the stuff that surrounds cells. And this has had some success, but that has also been very fraught. It's very difficult to get it right. Um, there are other approaches that have been tried. There's something called decellularization, which essentially involves taking a donor organ that may not be immune compatible or may not even be from a human, and basically um, submerging it in acid for a while so that the cells go away. What is left is the vasculature, the blood vessels, the proteins that make the structure of the blood vessels. And the idea is you kind of repopulate this skeleton, this scaffold, with cells. But again, it turns out that that's a lot easier said than done. All right, so, well, what are the problems? Why is this so hard? A lot of people have come to the conclusion that a huge barrier is the fact that when we try to grow an organ in the laboratory, we are trying to recapitulate what happens during normal development, during prenatally, and that makes sense. But there's a big difference, which is that when a baby is growing in the womb, all its organs are talking to each other through the bloodstream while they are growing. And the signals that are being exchanged between the organs seem to be really important in order for the growth of the organs to actually work properly. So the idea is, well, maybe if you could somehow do that, you could actually try growing all the organs together, but outside of a womb, in the laboratory, then maybe they would grow better than they do when you try to grow one organ in isolation. And this is one of the big ideas that's now being pursued, and this article I mentioned discussed. There was another article about a week earlier in Wired magazine, so another high-profile general audience publication. Um, you know, it's very plausible. And, we won't know how well it works until we get until, when I say we, it's not my group, of course, doing this, but the people who are working on this, would need to get a bit further before we can really evaluate whether that's a viable approach. But it's pretty promising right now.
Okay, great. So yeah, so yesterday I was just doing a bunch of research, and I came across the Longevity Science Caucus. Do you know? And I think I saw that the LEVF is a sponsor of it or something.
Yeah.
Can you,
Yeah, sure, I can fill you in. So the Longevity Science Caucus is a bunch of congressmen in Washington, D.C., who, this caucus concept happens a lot in DC, apparently. But anyway, this caucus was put together by a lobby group called the Alliance for Longevity Initiatives, A4LI. And yes, we work very closely with A4LI. We actually seed funded them 3 or 4 years ago when they started out. And I'm very happy with how that has gone. They wouldn't exist without us. And, that was a very good use of our money. But they are, doing great things now. The caucus is actually, I would say, not the biggest thing that they've done. One other thing that they've been heavily involved in is getting legislation passed at the state level, not in Congress, not in DC, but at the state level. This all began in Montana, where there was a state senator named Ken Bogner, who worked very closely with the A4LI, came up with legislation. It went through. There was actually two bills that were enacted, one in 2023 and another one last year. And the long and short of it is it expands a federal law called the Right to Try law. So I was talking earlier about how expensive and how laborious it is to get a single drug approved and prescribed to people. The reason for that is because the FDA, the Food and Drug Administration, has rules about the safety of any new drug before they can approve it, but it also has rules about the efficacy. The drug has to be shown to be significantly more effective against some condition or other than any other thing that's already been approved beforehand. And that's a really tough thing to do. That's really the main reason why the approval of new drugs takes such an enormously long time and an enormous amount of money. So what happened in Montana was they passed a law saying that you can forget about efficacy, basically. You only have to focus on safety, which is much less expensive to demonstrate. So essentially, when a drug has gone through what the FDA calls phase 1, then it becomes eligible to be sold in Montana. And of course, it still has to be prescribed by a doctor. And furthermore, it's not reimbursable the way that drugs that have been through the proper federal process are. But still, you can get these things. And the reason why this is called an expansion of right to try is because there is already a federal right to try law that's more or less the same, except that in the federal law, you can only access these unapproved drugs if you are terminally ill, which is defined as basically you have to have some condition and you have to have tried things that the already been approved for that condition, and they have to have not worked. You have to be not responding to those treatments. So you are then allowed to try something unapproved. In Montana, you don't have to be sick. So, in other words, the law is actually applicable to preventative medicines, which, of course, is what I'm all about. So, it's a really important breakthrough. And, uh, you know, of course, the same thing needs to happen elsewhere. It needs to happen at the federal level in the end. But first things first, lots of work is going on in various other states to try to do the same thing. In fact, there's a vote in the Senate in New Hampshire. I think it's actually tomorrow on this. So, progress is being made. And this is all, enormously being spearheaded by this one organization, the A4LI that I mentioned.
Oh wow, awesome. So if you're watching this video, so today I called my congressman's office and asked him if he would consider joining the longevity science caucus, and the office will get back to me. If you're watching this video and you think consider calling the congressman's office and also your senator's office. Uh, I think. Oh yeah. So I'm going to be a small time donor to the LEBF. I was, yeah. So no, I'm just very small. I mean, not that small, but I'm gonna. So I found. Can you tell us uh, about small donors? I mean, I know you said a billionaire would make a huge difference.
Well, so of course, every dollar counts. Um, excuse me, the majority of nonprofits for different causes get most of their money from small donors, just because there are a large number of those small donors. Now, in tech and in biotech, it tends not to be that way. The majority of the money comes from large donors, and that's certainly true for LEV Foundation. But I want to change that. Absolutely. I want everybody to help as much as they can. And 100,000 people giving $100 is still, $10 million, So that's absolutely what I want to have happen. So first of all, thank you so much for your generosity. And, everybody, something I often say is, if you're saying to yourself, oh, I can't do anything because I don't have very much money, remember that the less money you have, the more people you know who are wealthier than you. So you don't just necessarily have to give your own money, you can also advocate to other people and get them to give money.
Right. I made a lebf.org hat.
Okay.
And I kind of lost it, or I would be wearing that right now. But I'm gonna get that made again and wear that when I'm walking around. So hopefully that makes a difference.
Good.
Uh, yeah. So there's a lot of money out there. So like there's 1 billion people in the developed world. So so if everyone gave $1, that would be enough. But
It totally will. That's right.
but if you're part of it, don't just give $1. Give more than that. I'm just talking here. So, oh yeah. Well, it's been 20 minutes, so it's been a half an hour already. But I have some more questions. So, let me see. I hope we can continue. Let me see. Oh yeah. So basically, I forget. Oh, this is about. I forget. I don't know how to pronounce this tribe's name. They're called Tissamanians. I don't know if you know. They're basically, excuse me. They're basically a primitive tribe. I don't know. I don't know if that's the right word to say, but they basically live in the wild, and they basically have no not atherosclerosis, uh, but and their brains shrink like 70% less. And I think there's like no atherosclerosis for in animals in the wild. Um, so if you really, I mean, and also let me just say some things, and I would like you to say some things about it. So also, but to some, I don't know how to pronounce it. This primitive tribe in Bolivia, they're active. They're very active, and when it comes to diet, they eat rice, but I don't think they have white rice. They probably have like brown rice. They eat a lot of carbs, but they also eat a little bit of game. But they're probably calorie restricting. So yeah. So your turn.
All right. So, yes, so primitive tribes have been studied for quite a while for their avoidance of the what are often called the diseases of prosperity, which certainly means type 2 diabetes, but it also means heart disease, as you say, and to some extent Alzheimer's disease. Um, it does appear that the lifestyle and diets of these primitive tribes are protective relative to affluent diets. And indeed, there is a movement these days to adopt such diets. It's called the paleo diet. Um, and yes, I mean, the evidence is pretty good. But what we must always remember is that even though there are particular diseases of late life, such as heart disease and diabetes, which are accelerated by a Western lifestyle and a Western diet, nevertheless, there's plenty of other aspects of aging that don't seem to be in that category. Um, so, these people in these primitive tribes, they don't live to 1,000, they don't live to 200, right? And sure enough, people from the West who adopt these diets also do not live significantly longer. Now, you're absolutely right to mention not just the composition of the diet, but the amount of the diet. In other words, the possibility that a lot of what's going on here is protection as a result of essentially calorie restriction. The point I want to make about calorie restriction is that it's a very good way to extend the lifespan of mice and rats. This was discovered a century ago, and the extension is quite significant. You can maybe give a mouse or a rat 50% additional life just by feeding it less than it would like. Um, but calorie restriction has been well known for a long time not to work so well in long-lived species. If, like 30 years ago, Purina did a big calorie restriction experiment in Labradors. So they live on average about 11 years, so maybe 4 times longer than your typical mouse, right? And they only got a 10% increase instead of the 50% you can get with mice. Um, uh, there were two really big and really expensive experiments done on calorie restriction of monkeys in the US, which concluded about 10 years ago. And those studies, you got a couple of percent if you're lucky. So it just doesn't seem to work on long-lived species. And we kind of understand why that is. It's essentially because the way that the reason calorie restriction works at all in any species is because it gives an evolutionary advantage. It allows the species to do better in terms of passing on its genes in the context of famine. And long famines that last for multiple years just don't happen often enough to give that selective pressure. So basically, we understand why this is, but it is. So it's not surprising that a paleo diet or any of these other, modern fashionable diets, they may be good for some people to some extent, but they're not good for anyone to a dramatic extent.
Yeah. Um, so yeah, thank you for that answer. Oh yeah. So it's been like 35 minutes. So I guess I'm gonna talk about Brian Johnson.
Okay.
So you know, okay. So let me see. We all can't do the test that he's doing, but oh yeah. So you talked about diet for a minute ago, but different people try a different diet. So uh, uh, I would like to. I came across something somewhere online that you were vegan. Is that true or no?
No, that's nonsense. I am an omnivore, but yeah, Brian is a good friend of mine. He is making a big difference to the longevity conversation, shall we say. He is a very wealthy guy, of course, and he spends, so I gather, about $2 million per year on his own health, which of course most of us cannot do, as you said. But he has gone a long way towards developing the ways in which other people with modest means, can improve their lifestyle and diet and so on in order to live longer. One thing he's very strong on is sleep, which is something that a lot of people neglect, of course, in today's busy modern world. But it's very, very important for maintaining, minimizing one's rate of aging. So, what do I think? Well, I mean, I think the critical thing, as I mentioned at the beginning, is not so much to have a grand plan for the entire defeat of aging now, but rather to have a grand plan now for how to get people to be enthusiastic about defeating aging, whereas at the moment almost everybody is basically just putting it out of their minds. Um, and I've done a lot of public speaking over the past 20 odd years. And for the first 10 years of that, I was basically the only one doing it. The only subject matter expert who understood the biology, but also was trying to change public opinion. And I didn't really achieve very much, to be perfectly honest. I mean, I did a lot of high profile talks, like my TED talk that you mentioned earlier, but it didn't really change, it didn't really move the needle. And I feel that that's basically because even though I know my shit and I can definitely give a cogent argument, I'm a scientist, and the way I describe things involves relying on logic, and logic is not always the best way to change people's minds, right? So when other people have come along in the past decade, so Brian is certainly one of them. I always mention Liz Parrish also. She's another very important person in this field in terms of advocacy. These are people who have a different style. They say more or less the same thing, but as I do, but they say it in different ways and they get through to different people that I don't get through to. So I'm very happy that people like Brian Johnson exist. And, Brian, one thing he does that's very important is he's completely shameless. He he gets a lot of he gets a lot of hate, you know, and he just rides it. He doesn't let it slow him down. So I admire him for that.
Yeah. So I mean, yeah. Let me before I ask you some. I guess I can say this right now. But well, basically, I'm an on and off vegan.
Mhm.
Uh, but oh yeah, let me ask you this. So Brian Downs Johnson does a lot of tests, but I think, um, like, well, according to what I know, well, about what I know, but basically, people should get their arteries checked. Uh, in- like arteries checked. So because you can basically be on whatever diet in your opinion is best, but if you check your arteries and the arteries
Yeah.
are uh, messed up, then you have to rethink.
Yeah. So
Uh,
let me talk about that a little bit. So the key, in fact, let me talk about something a bit more general. One thing that Brian has always been very strong on, and so am I, is measurement. The fact that you can only optimize your health and minimize your rate of aging if you know what you're dealing with. And, different people are different. both genetically and in many other ways, everyone's got different metabolism. Everyone's got different weak links, Achilles heels, and you've got to know what they are in order to go forward. So you mentioned one's arteries. Of course, that is certainly one example of this. One needs to know whether one is accumulating plaques or whatever, whether or not it makes sense to get prescribed a statin or or to change one's diet in order to address the buildup of cholesterol in the artery, because after all, still, heart attacks and strokes are the #1 killer in the Western world. So that's just one example. But yeah, I mean, it costs very little to get one's blood work done, once a year, and to have that kind of thing checked. If you want to get it checked at a kind of high-end way, then that costs more, of course. There's something called a whole body MRI, which you can do. That costs plenty of money. And if you're not Brian Johnson, Brian Johnson has an MRI machine in his house. Not many people have that. But yeah, within one's means, one needs to measure what situation one is in. Another example is one's genome. So that's something that does not have to be measured every year. It doesn't change, right? If your genome stays the same. But getting it sequenced once, that costs less than $1,000 these days, which is, not very much for something that you only have to do once in your life. And you can get a lot of information from that. I take one variant form of vitamin B12, started taking it after my genome was sequenced, because the sequence revealed that I have a particular variant of a particular gene that predisposes me to having high levels of something in my blood called homocysteine, which is generally considered to be a bad thing to have high levels of. And this particular type of vitamin B12 fixes that. But yeah, I didn't know that until I got my genome sequenced. So yeah, measurement is critical, and certainly you're quite right to highlight calcification or fatty deposits in the arteries as one of the biggest things to know about.
Okay. So like just out of curiosity, how many people, like how many donors donate on a regular basis to the Olivia Foundation?
Oh, not nearly enough. Like, a few dozen.
Oh,
It's really, it's really sad. We are very much in that state still where the overwhelming majority of our income arises just very occasionally when someone wealthy writes us a big check.
oh wow. That's not good. I'm just talking here, but I don't know. Well, you basically want $1 billion in 10 years, but
well, I'll take $10 million right now. I mean, let me talk a little bit about where the money's going that we get. We do experiments on mice that are very large by the standards of most experiments on mice. So the next one that we want to do will involve 2,000 mice. Most experiments will have a couple of hundred mice. But the reason we need so many is because we are testing combinations of treatments. The researchers around the world have discovered a lot of different ways to make mice live a little bit longer than they normally would. Maybe 10, 20% longer, maybe a couple of months longer, because mice normally live about 2.5 years. We're interested in putting those things together, in giving mice a combination of these things and identifying combinations that are additive, that give more life extension than any single one. We did one of those experiments starting in 2022, ended last year. It was somewhat successful. We did show that we can get additivity. We can get more of an effect from the combination. But what we did not yet do was to break the world record. We still can't do any better than what you can do with calorie restriction. And we think the reason we didn't do better than that is because we only use 3 damage repair interventions. We're addressing different types of damage, of course, but this time we want to do 8. So we believe we've got a much better chance of essentially ticking all the boxes and getting a big effect. But yeah, 2,000 mice, it costs a bunch of money. The experiment will be something like $6 or $7 million to do it all. And we need to raise a fair proportion of that before we can even start. So, I'm not talking a billion at this point. If I can just do that, then we'll have made a lot of progress.
Yeah, yeah. I'm just well, I guess I want to title this a podcast, but I'm just talking here. But $1 billion in basically, you can basically get if you $1 billion of work can be done with around 250 in India, even less in in Thailand. I'm not telling you to
Oh,
move to
no,
Thailand.
we look around a lot to see where to do this kind of stuff. So, as I say, this experiment, in its current budget, costs about $6 or $7 million. The thing we want to do next, um, and yes, we could save maybe a couple of $1 million by doing it in India or in Thailand. But we wouldn't save more than that because it's not just the manual labor. We've also got there's obviously expertise involved, but there's also the reagents. You've got to get the mice. You've got to get old mice because we want to start when the mice are already in middle age. You've also got to get all the chemicals and the cells and the gene vectors and so on to actually do the interventions. And these things you can't reduce the cost of that very much just by going somewhere else in the world. Then you've got to take into account the fact that these experiments are very challenging to actually do. You can just get them wrong and learn nothing at all. And that means that you need really expert people who are very familiar with doing mouse lifespan experiments. And there aren't many of those around.
Okay, thank you for that answer. Yeah, this is the this is kind of well, I am a Tamil Sri Lankan American, so I don't know if you know what. So basically, I'm just out of curiosity. Do you know any? Uh, I looked up some. I looked it up, and there are some prominent Tamil biotechnology researchers and stuff like that. One person I came across, he did some research on Alzheimer's. I didn't. He basically he found out that some protein is not as active in older brains, and if you supplement for it, I should have written it down. But yeah, so I'm a Tamil Sri Lankan American. So do you know any prominent Tamils
I don't.
in your field? Oh,
I don't. Please go and look them out for me. Especially ones who can write large checks. Always. You can have greater impact as an advocate if you are part of the community that you're talking to. So, I don't think I've ever done a podcast with someone Tamil before. So, you should make use of that.
okay. Oh yeah. So I have some few more questions. It's been 48 minutes already. I have a few more questions. Oh yeah. So rapamycin. So you're obviously an expert. There's a lot of opinions on rapamycin. Uh, what do you? I mean, so Brian Johnson made a video basically saying that you nodding your head, so you basically know about that. Basically, stop taking rapamycin.
Okay.
Please,
Oh, yeah.
yeah.
Right. So rapamycin is generally considered to be the best compound we have that, if you like, tricks the body into thinking it's on calorie restriction when it isn't. These drugs are called calorie restriction mimetics. And yeah, rapamycin seems to be a really good one, at least in the laboratory. So people have used it in mice and they get more or less the same amount of life extension that you can get with calorie restriction. And the mechanisms, as measured by what goes on in the metabolism of the animal, seem to be very similar to what happens with calorie restriction. So that's all very interesting. But as I mentioned, calorie restriction itself doesn't really work very well in long-lived species like humans. So that's important to take into account. And all of these drugs that trick the body, as I say, into thinking it's on calorie restriction, they work in different ways that have other effects as well. So, for example, rapamycin was originally developed to suppress the immune system, which is something you might want to do in certain cases when you're delivering different, like cancer treatments or something. You don't necessarily want to do that to healthy people. Now, most people think that the dose that's required to do immune suppression is a lot higher than the dose that would be used for being a calorie restriction mimetic. And therefore, you shouldn't have that problem. But as I mentioned earlier, different people have different metabolic features, different characteristics. So it's no surprise if some people don't respond or respond negatively to rapamycin, same as any drug. What we must not ever do, however, is assume that because one person, even if it's Brian Johnson, has a negative effect from something, therefore everybody's going to. This is not in and of itself a reason to not look at rapamycin or similar molecules as potentially beneficial.
Thank you for the question. I did watch that video. I mean, he's like, I mean, he's not a perfect person, and I was kind of very angry uh, that he kind of made this video and basically held it up and called it poison. I'm kind of, no one's perfect, but he has experts, experts in his team. So I don't know why. I'm
Yeah,
kind of.
he's definitely a personality. He does overstate some things, in my view. So I mentioned sleep earlier on, right? So I think that it's great that Brian emphasizes that it's important to get enough sleep, but he goes further. He says it's important to have a constant sleep schedule, as opposed to being short of sleep one day and then catching up the following day. Um, and I'm perfectly happy to believe that he needs to keep a very stable sleep schedule. There was a period of time when he actually would refuse to travel anywhere that involved crossing more than two time zones because it would mess up his sleep schedule, right? Um, uh, but yeah, I mean, so if it works for him, more power to him. But I, for example, I definitely make sure that I get enough sleep. But if I have to travel transatlantic or whatever, and my sleep schedule is messed up, it doesn't affect me at all. I just have to catch it up, but that's all. And I think a lot of people are more like me than like Brian. So it's important not to be too universalist, if you like, about the recommendation. And I think what you're saying about Brian's attitude to rapamycin is exactly the same.
Right. Thank you. So I was kind of, I kind of did some. I was kind of all day. I kind of looked up stuff on this tribe in Bolivia. So they basically don't have um, any cardiovascular disease, but their muscles, they age. Uh, but they have very low life expectancy because of infant mortality as well. Oh yeah, before can you? I'm going to get my C-reactive protein tested. Can you tell us something a little bit about inflammation, please?
Sure. So inflammation is, of course, a genetically encoded, evolved thing that we have as part of our defenses against infections. It's part of the way that the body gets rid of infections. But there is this phenomenon, which, as you say, is often called inflammaging, which consists of a gradually, inexorably increasing amount of inflammation happening during late life without the presence of infections. So what's going on there? What's going on is that the immune system, of course, has to recognize uh, what's an infection in order to know what to do, right? So in the same sense, in the same way that some people have autoimmune diseases, like, for example, type 1 diabetes, similarly, the inflammatory response can be mistargeted sometimes. And it turns out that it is, to a low degree, mistargeted to certain types of waste product that accumulate in the body. So one of those waste products is amyloid in the brain in Alzheimer's disease. So the inflammatory state of the brain, increases and becomes bad, becomes maladaptive, if you like, as a result of the accumulation of amyloid. It also happens in the arteries. So when you get these fatty deposits that we were talking about earlier, initially they're harmless, they're inert, nothing happens. But eventually, when the fatty deposits get big enough, the cells around them start to get angry, and they start to exhibit this inflammatory response, and that kind of gets into a feedback loop. This makes the accumulation of waste happen more rapidly than it was doing beforehand. So yeah, that's what inflammation is. So what do we do about it? Well, one approach, which has been taken for many decades now, is to dampen down the body's ability to have an inflammatory response at all. So, for example, there are things called non-steroidal anti-inflammatory drugs, NSAIDs, like aspirin, that are, reasonably good at doing that. And they do indeed slow down this maladaptive feedback loop that exists in late life in relation to the inflammatory response. But, of course, they have this rather important side effect, which is that your ability to fight off infections is also diminished, because your inflammatory response in general is diminished, right? And that's why, well, that's one reason why there's a big, there's a hard limit on how much of the NSAIDs you can take. So what we should really be doing is not targeting the inflammatory response. We should be targeting the target, the stuff that the inflammatory response is maladaptively going after, like amyloid or atherosclerotic plaques. And that's what we do. That's what I've been trying to do in a variety of projects over many years. Our work on atherosclerosis went pretty well, and it was actually spun out into a startup company that is currently engaging in a clinical trial of an approach to getting rid of the stuff in the arteries. That's happening in Australia right now. So yeah, this is very important. But as I say, it's definitely superior as an approach, as a medical approach, rather than what we've been doing up until now, which is dampening down the inflammatory response overall.
Okay. So, I mean, according to, I'm just gonna say some stuff, and then you can respond. So, uh, basically, yeah, the muscles get the strength declines as you age, and according to um, basically, like I said, most of my research is just looking stuff up on Gemini, but Gemini and Gemini. So, um, so what I what I'm under what I understand from what I looked up is basically uh, inflammation is kind of bringing the strength of our muscles down. So like so basically I looked up how to reduce the inflammation.
Mhm.
I don't know how much to
All right.
reduce.
So yes, inflammation is bad for you if it is chronic. In other words, if it continues to go on for a long time. That's what inflammaging is all about. And yes, muscle, the decline in muscle strength is just one example of that. And that's not surprising, because the inflammatory response did not evolve for this purpose. It evolved, as I said, to help us eliminate infections. And if the infection is successfully eliminated, after that, then it's kind of okay if you did some, if you like, collateral damage in the process of getting rid of the infection, because you can repair that damage then, at your leisure after the infection has gone away. The problem comes when the inflammatory response is targeted against something that can't be eliminated that way, which is like these waste products I mentioned. And then it just tries and tries and tries and never succeeds. And the inflammatory response never, it does more and more collateral damage. And we never get to the point where that damage can be repaired.
Okay, thank you for the answer. Yeah, I have a few more, Aubrey. It's been almost an hour. Just a few more, and then I'll let you go. So in Prospera, so they in Prospera, Brian Johnson went to get his. Basically, I've known about myostatin and how. Inhibiting myostatin, basically, all these animals are huge.
Mhm.
But so there's a company. I need to look up the company. I mean, you look up the company. Basically, they're doing gene therapy that increases the follistatin in your bloodstream. It costs around 25K to get it done, but it's only effective uh, for 1 year.
Right.
Yeah,
So yeah,
about
the company is named Minicircle. I'm very familiar with them. And yeah, and quite a lot of people have received that treatment now, and a number of those people have been very public saying that it has been very effective for them. Now, this is just like anything else in metabolism. If it works, then how long it's going to work for will vary from one person to another. There may certainly be some people for whom it doesn't work at all, even initially. Um, and certainly the approach that Minicircle have developed for delivering this gene and increasing the levels of follistatin in the bloodstream, this method is quite novel, or to be more precise, it's a variation on an approach that is not novel at all and that everyone rejected a long time ago, called plasmid delivery. The reason people rejected it was because it didn't work for anybody. And so whatever Minicircle have done, it does seem to be, a bit of a breakthrough. Uh, of course, one always has to worry about uh, what's called the placebo effect. People, feeling better even though there's no actual physical benefit. But a lot of measurements have been made on people who have received this treatment over the past few years, and it's pretty hard to ascribe it at this point to a placebo effect. So yeah, there's a lot more we need to know about follistatin, about its benefits, and so on. But it's looking like we do seem to have ways to deliver it in a manner that's beneficial to some people anyway.
okay. Thank you. That's almost it. Oh yeah. Metformin. Uh, so so right now they're working on doing a metformin study on
Mhm.
healthy adults. I
Yeah.
think.
So metformin is another drug that comes under this category I mentioned earlier, the calorie restriction mimetics. It doesn't work in the same way as rapamycin, but it works in a different way. And it was developed many, many, many years ago as a treatment for diabetes, and it works pretty well against diabetes. But not long ago, like 15 years ago, maybe, people started to realize that there was evidence that it might be beneficial against other aspects of aging. So an effort was put together to do, as you say, a clinical trial. This, of course, would be a phase 3 clinical trial to test whether it works rather than whether it's safe, because everyone already knows it's safe. It's been around for a long, long time. And this trial was going to be to check whether it affects aging in general. Now, the first big challenge was to describe a definition of what aging in general actually is that was satisfactory to the FDA, because that you have to have that in order for the FDA to say, yeah, you can do this trial, and if you do, then we will approve the drug for this thing. But they managed that. So the only problem is that the trial has never actually been conducted. And the reason it hasn't is because a phase 3 trial, as I mentioned earlier, costs a lot of money, and no one's going to make any money back from this drug, right? It's been off patent since before you and I were born. And So it has to be paid for out of non-profit funds. There was an attempt to get it funded by the NIH, by the government, and there was a huge fight about that at the internally. Essentially, one of the top people in the NIH resigned as a result of other people in the NIH torpedoing that grant. But the fact is that even though the trial hasn't happened, it has still had the benefit of, as I say, enshrining this definition of what aging means in a term that's compatible with doing a clinical trial, which means that if anyone else, any big pharma company, for example, comes up with a treatment that they believe has benefits on aging in general, then they can do a clinical trial using that same clinical endpoint, and they don't have to, go back to the FDA and have long, tedious, laborious arguments anymore because it's already been approved. I mean, I'm somewhat oversimplifying, but basically that's the situation.
Okay. So, so basically, what I understand is metformin. We don't know if metformin is good for people who are healthy. I don't know what percent of the world really is healthy. But say someone is well, Brian Johnson, I guess you can say is healthy, but he's taking metformin. So, and you just said that metformin is safe, but does it? I came across someone on YouTube. He said something about metformin lowers your B12 or something, and he basically he's basically saying not to take metformin. I don't know why he doesn't just say it might lower your B12 and just supplement for B12. So you just said metformin is safe. So would you say people that are healthy should take metformin?
Well, I mean, as I say, it's a calorie restriction mimetic, which means that the benefits that you can get from it, assuming you're not diabetic, are probably very modest. As I say, there is kind of circumstantial evidence from the literature, from other studies, suggesting that maybe there are other mechanisms of action of metformin over and above being a calorie restriction mimetic that may make it more beneficial. But the evidence is very tentative right now. I don't see many of my colleagues expert colleagues saying, that the evidence is strong. And, that means it comes under this category of, individual metabolism. It may help some people, it may not help other people. It's unlikely to help anyone a lot unless they have diabetes.
Okay, so just a few more, Aubrey. Ray Kurzweil thinks he will live very long. So I mean, not immortal. Immortal is an infinite lifespan, but he thinks he's going to live very long. He's like he's probably 20 years older than you. Do you think, like him, that you are going to live very long?
Well, first of all, yeah, he's not quite 20 years older than me. He's more than 10 years older. I think I've got maybe a 50-50 chance. The key thing that both Ray and I have emphasized for the past 20 years is that we don't have to have a complete solution to the whole problem in order to have people benefit. Because we're talking about preventative maintenance, damage repair, even if we can only do it fairly well, let's say we can give people an additional 20 years of healthy life, that will be enough so that research can improve during those 20 years so that we can rejuvenate the same people, and give them another 20 years and so on. And that's what I've called longevity escape velocity. Ray talks about living long enough to live forever. So, yeah, the question is, how soon are these things going to come along? And of course, we don't know. With any pioneering technology, you can never say for sure what the time frame is. But Ray and I have both been willing to stick our necks out and give time frame predictions. The ones that I give are always probabilistic. I always say I think we have a 50-50 chance of whatever. And in this case, I currently say that I think we have a 50-50 chance of reaching longevity escape velocity within the next 12 to 15 years. That depends on reaching this threshold in the laboratory called robust mouse rejuvenation within the next 3 or 4 years from now, which is something that I believe is going to be both necessary and sufficient to change public opinion and get the world to really treat aging as the new COVID. That's my favorite slogan these days.
Oh, okay. Just I came across a video a long time ago. Basically, you said you were agnostic. I go to I am a religious religion. Well, Gandhi said all paths lead to God, including atheism. It's funny. You said you were, I think you said you were agnostic. I guess I can, even though I go to, right now, I'm going to Lutheran church, and sometimes with my mom, I go to Hindu, Colville. Without going more into detail about what I do, do you go, I mean, do you go, I mean, it's Easter is coming up. Are you still an agnostic? And do you, even what's his name, Richard Dawkins goes to church. So do you do anything like that? Go to church or anything like that?
Yeah, I do not. I would still call myself an agnostic. Many years ago, when I was a teenager, I flip flopped a bit about what I thought about the existence of God and so on. But eventually, I came to the conclusion that it didn't really matter what I thought, because I had already, for other reasons, decided I wanted to dedicate my life to humanity, to making a difference to the world, which is, God's work, right? So this is what Holy Scripture of all kinds tells you to do, and I'm doing it anyway. So it kind of doesn't matter why I'm doing it.
Okay, one last question, Aubrey. Supplement wise, yeah, a long time ago, you said you were not taking any supplements, but I think you just said you're taking B12 because you tested for B12 deficiency. Other than that, do you take any supplements?
Yeah, no, at the moment, I take the view that everyone's got to, respond to what their own body is doing. And I'm one of these repulsively lucky people. I can eat and drink basically what I like and nothing happens, and I don't even need to exercise. So for me, the sensible thing to do is to be conservative, and if it ain't broke, don't fix it. But I, of course, am very strong on, as I say, measurement. I get very high end measurements of everything in my blood, 150 different things and all manner of other things like cognitive tests and so on. So I am constantly making sure to have as much, shall we say, as much warning as possible before anything of anything changing, so that I can, adapt and change my own diet, lifestyle, whatever, in response to that as and when necessary.
Okay, that's all the questions that I have to
All
ask
right,
for you
thank you.
today. Before I end the recording, if you came across this video, like I said earlier, if you're part of the Aubrey Grey team, I would like for you to subscribe. I'm not trying to do it for the money. All my money that I make from YouTube, I plan to donate to research. Is there anything else? Oh yeah, Aubrey de Grey's website. Robert Aubrey currently, if you don't know, his foundation is called Longevity Escape Velocity Foundation. The website is lebf.org. Please check it out and contribute. Thank you so much, Aubrey. See you later.
My pleasure. Thank you, Sash. Bye for now.
All right, bye. Recording ended.